Good morning. I want to thank each and every one of you for joining us. And I don't know who was in charge of the weather, but they did very well. And so we did not receive the rain we might have expected. But here to visit with you about a letter that my colleagues and I sent to Secretary Sebelius back on June 2nd, asking for a fuller disclosure of the waiver process under the President's health care plan. We asked for a long list of information about who had been denied waivers and why and reasons they were granted. And we requested a response June 15th. That would be last week, exactly 1 week ago. Last Friday, 2 days after our deadline, and with no direct response from the Secretary, the Obama administration dropped the news that HHS would actually stop granting waivers 3 months from today. And what response did we receive? And I'd like to show that to you. And I want to remind you that this is a response from the most transparent and open administration in the history of our country. Obviously, the response was no response. And we want to make sure we didn't have that board upside down in case you wanted to read what the response was. But this is par for the course for this administration. There was some information placed on the website late on Friday on some of the waivers, but the letter requested disclosure on the annual limit waivers, the state innovation waivers, the medical loss, racial adjustments, and any other waivers or adjustments under the Obamacare. And we're still waiting to see what applications are pending, what length of time it takes to approve a waiver. But in short, what this entails here is that many of my colleagues were sent to Washington to change and put an end to Washington's games. And these waivers represent more of the same, that if you want to participate in the process, you'll find out the rules are secret unless you know the key players and the referee. Obamacare was pitched to the American people as making health care fair for all, yet waivers do exactly the opposite. It makes it a choice between the haves and the have-nots. Some get to be exempt from the law, while the rest of America has to live under it. And in recent weeks, we, of course, have heard certain areas, certain districts, such as a district of the former Speaker, where their constituents receive waivers and many others have not. But again, as I asked the White House in January, and as many of my colleagues have done as well, if Obamacare is so good, if it is so good, why all the waivers? And if the waivers are so important, why the lack of information? Why the lack of transparency? When you have an administration that pledges to be the most open and transparent administration in the history of this country, why the lack of response? Why the fear to show us who is receiving waivers, who has been denied waivers, what states have been allowed waivers, which ones are still pending, why are they pending, why did you grant those waivers? Those are all unanswered questions from this administration. Then one last thing, and then I'll turn it over to my colleagues. We learned last week that approximately 30% of employers anticipate dropping their health care coverage as a result of this law. And so more things are coming to light and showing that this simply was not a good piece of legislation. I'm certain there'll be a question asked, well, why haven't more waivers been requested that we know of? And this here is probably the amount of information that any small business would have to supply to Secretary Sebelius if he would like a waiver. Dozens and dozens of confidential information about health care plans that, yeah, take a close look at that. That's empty sheet. We did also looking at what would a large business, in order to receive a waiver, what would they submit? If you were the HHS and you would like to request a waiver under Obamacare, what would it take? How much information would you have to provide? That would take 26,000 pages of data that the agency would have to provide for a large-sized business. So obviously many employers have not sought the waiver because of the tremendous paperwork. But in summary, though, waivers should not be about some. It should be waivers for all. This bill was supposedly about equality before the law, and the waivers actually demonstrate is exactly the opposite. Again, I want to thank my colleagues for being here. I have many other members from other states, including the entire congressional delegation from the state of Kansas, and given our current secretary is former governor, I would like to first turn it over to Lynn Jenkins, from the state of Kansas. Congresswoman, thank you.
Thank you, Tim, for your leadership on this issue, and I thank my colleagues behind me for keeping this issue in front of the American people. I am Lynn Jenkins, representing the 2nd Congressional District in Kansas, and in the spirit of full disclosure, I voted against the President's health care bill last Congress, and I have voted and worked very hard this year to see that it is repealed and replaced. But despite my personal opinions on the underlying legislation, I've had many friends at home ask me sincerely if these waivers are being used for political purposes. And unfortunately, I am unable to answer their question because we simply do not know. Whether they support it or oppose it, they just want transparency and accountability from Washington. The problem here seems to be the Secretary is unwilling to clearly identify what criteria she's using in the waiver decision-making process. Folks at home view this as proof that the law is a failure, and D.C. is using a series of sweetheart carve-outs that offer special treatment for well-connected fat cats to keep it on life support. Let's be honest, Washington has been lying to us for years. Government trust is at an all-time low, and this situation just creates a greater sense of arbitrariness in a political environment of massive skepticism. So, Madam Secretary, we call on you to shed some much-needed light on this situation today and provide a bit of transparency to clear this up for Kansans and for all Americans.
Thank you, Congressman. Next up, Congressman Mike Pompeo from Kansas as well. Mike.
Thank you. Thanks, Tim, for leading on this. Thanks for my colleagues for being up here. You know, the entire Kansas delegation is here. When our governor left Topeka, we knew she was coming to Washington, but we had no idea she was going to adopt Chicago-style politics when she got here. I was a small business person just 22 weeks ago. I promise you that the company that I ran doesn't have the resources, nor would it have been granted a waiver from the incredible costs associated with Obamacare. And so we stand here today saying, let's repeal this bill. Let's grant waivers for everyone. Let's not do favors for our friends. Let's not punish our enemies through the healthcare system. Let's put in place a plan that reduces costs, provides good access, and once again give folks in South Central Kansas and all across America a chance to create jobs. Instead of having folks come back here beg for mercy from a healthcare plan that is driving up costs dramatically. So, Madam Secretary, please think about Kansas, not Chicago. Think about American workers, not your next job. Make sure that we're doing the right things for job creation here in America. Thank you.
Thank you, Mike. Next up, Kevin Yoder, also from the state of Kansas. Congressman? Just slipped out, had a meeting, and I have some other colleagues as well. I think Paul Gosar from Arizona. Congressman?
Thank you very much, Tim. From government oversight and the vice chairman of the health oversight, we got to see firsthand about how a process has gone awry. It also shows a lack of transparency. Once again, an administration picking winners and losers, particularly when we're either in or all out. This is once again the American public taking a disc. What we have to do is we have to answer questions, all questions, and not just kill a program, but be transparent to the American people. And that's what we've seen from this administration and from this agency. It's another example of an agency gone wild. Thank you.
Thank you, Congressman. Tim Walberg. Tim, would you like to make some comments?
Thank you, Tim, for using this opportunity to call attention to the fact that openness, transparency isn't taking place. I'm Tim Walberg from Michigan 7, a state that's been hard hit with unemployment. My district, up until just recently, was still averaging at 10% unemployment. We are frustrated with an economy that holds us back. And then when the government reform of health care took place, we saw another impact that was huge in its negative impact. I sent a letter back on May 4th, almost a month prior to the letter that I joined in with my colleagues here, asking for the Secretary to respond to us, to tell us what was going on. When about that time, I had the opportunity to be in a McDonald's restaurant on the day that they were attempting to hire 26,000 new employees. Had success, and thankfully did, because the last quarter we saw the employment rate, the numbers of employment gains, was a result of almost half of that was McDonald's Corporation. McDonald's has a waiver. So I think we can safely say when you are not under the gun of what this Obamacare package mandates, you can hire employees. We ought to give that same opportunity to other employers around this nation. Last week we had a major food service restaurant chain in here that told me point blank they haven't been able to get the waiver. Ultimately, if they have to provide the insurance coverage to employees in response to this Obamacare package, and taking the place of what they are now supplying to their employees, which their employees take jobs because they can get that health care plan, it'll cost them almost 50% of their annual corporate income to cover that. That's why people are looking for waivers, and that's why there ought to be a transparency as to how to get it, who gets it, what the process is, and the Secretary ought to respond. That's all we're asking. With the letter that I sent in May, the letter we joined together in June, and the response that still isn't here. Secretary, please inform us so we can help our constituents who want to provide jobs, who want to take care of their employees and health care package to go on and be successful.
Thank you, Tim. Additionally, some other colleagues have joined us. We have Joe Walsh and Steve Pierce. Congressman, who would like to make some comments?
Thank you, Tim, and thank you for leading on this. Joe Walsh from Illinois 8. Let me take 30 seconds and point toward a different group of people. This is an outrage, and I don't know why your profession isn't outraged. If this were any other president or any other administration, you would be investigating this tooth and nail every single day. You know, we catch a lot of grief sometimes because we call this health care legislation Obamacare. He told us this was the single most important piece of health care legislation since Medicare or Medicaid. He should be proud to have his name on here. And it is an outrage if this is such a wonderful piece of legislation that over 1,400 organizations, corporations, unions, and groups need to get a waiver from it. This is a story. Why is this not a story? The fact that the Secretary hasn't responded, again, that's an outrage. But the biggest outrage is the fact that this administration passed this legislation, granted so many waivers, and they're going up every day and every week, and your profession won't cover it. You need to cover it. You would cover any other administration. This is an outrage to this country, and it needs to be looked at. Tim, thank you for taking the lead on this.
Thanks, Joe. Steve Pierce and Steve Womack as well.
Thank you very much. Steve Pierce from New Mexico. I'd like to join the others in thanking Tim for bringing this up, but also to repeat what Joe Walsh was just saying. You know, our friends on the other side of the aisle made a big deal last week out of adding to one of our appropriation bills a statement that you had to identify who your contributors were before you could have a contract with the U.S. government. I think that we should know the contributors who has been contributed to by the 1,400 people, 1,400 different groups that have been given waivers. In America, the thing that made our small businesses great was it was not who you know, but what you know. This administration is steadfastly turning the country into who you know, not what you know. When we do that, we're going to be less competitive in a time when we should be more competitive. We have approaching 9.5% unemployment for weeks and months. The reason we're doing it is we're making ourselves less competitive. And we, the American people, need an answer to why the waivers are being granted. They're being granted because it doesn't work. That's the reason the waivers are being granted. We just want to know now who they're going to and who the groups have contributed to. So join with us to demand this transparency from our President and from the Secretary, and I thank you very much.
Thanks, Steve. Congressman Steve Womack. Steve?
Thank you. Steve Womack from Arkansas. I want to thank my colleague Tim and his Kansas delegation for their leadership in this area, and I want to congratulate him for saving paper. We have dusted off last Congress's House budget, and so we're using that same platform today. You'll recall we used this same chart for the President's plan on Libya, so we are saving resources by recycling some of these presentations. Once again, here we are, talking about transparency, or the lack thereof. And I want to circle this thing back, as a couple of my colleagues have done, to jobs. Anytime there is a lack of transparency, the American public is being asked to wonder, to ponder, to guess, to speculate as to what the real objectives are here, what the real reasons are here for these waivers. And that's not healthy for America. It's not healthy for job creation. People need to know. We need to have a government that has certainty. And for doggone sure, we need to quit deflecting the decisions away from what's vested in this Capitol behind me and down the street in bureaucratic organizations and at 1600 Pennsylvania Avenue. The decisions, the critical decisions that will put America back on the right fiscal path are those decisions vested in the members of Congress, the 535 people who occupy this building behind me. And I thank again my colleagues for their leadership.